and then Louise from the Health Science Center, Health Innovation Center of the region here. So Leon is again one of my colleagues. He's in a different section at the Max McKinney Institute, also SDU Robotics again. So, and they actually recently got 2 nice grants, and I think this is one of them, the HealthCAT project. We should hear something more about how they plan on using welfare robotics in the future. So please, Tom.
Thank you. Yes, so HealthCAT is the one project, and we also have a smaller lighthouse project at SDU together with the Odense University Hospital, which are kind of related to each other. Both are revolving about the question at the moment, where can robots actually make a difference? This morning we heard all about the demographic change, so I don't want to dwell too much on it. Our belief is that in the future robots can actually be one of the solutions to cope with this challenge. The problem that we face is that maybe that helps. Yes. That we experience a gap between us engineers who know a lot about robot technology and what kind of problems we can address with that, and people from the healthcare domain that know a lot about actually problems at hand, which we engineers maybe don't. On the other hand, they have little clue about what robot technology actually can do. And this gap, both projects are actually aiming at mitigating. One issue that we realize is that often this idea that robots in one way or another can replace humans. And this is not going to happen. And this has, in my belief, led to quite a bit of frustration, because we always have the idea, or often people have the idea robots can replace the human in one way or another. And when trying to do so, we fail. And these failures has happened quite a few times. So what we want from the engineering perspective is actually to learn what is it that robots should do, and also how is it that they should do it. And in the Lighthouse project, together with the university hospital here, our strategy was to actually go out there and observe what is it that the staff members actually are doing there in their daily routines, and reporting on all these processes that are going on there. So the aim is to have insights in what they're doing, what is the context of the activities, and what are the challenges that they are facing. At the moment we have, I think, approximately 10 student helpers that work on it in part-time at different departments, following a nurse, following a doctor, following ordinary, different types of staff during a complete shift into kind of report on what is it that they're doing. We then afterwards break it down into different processes that we see there, and the idea is that some of these processes we will find to be reoccurring at different departments. Some of them might call for robotic solutions, while others don't. So the idea is that at the end of this, we end up with a catalog of processes such that we can differentiate which of these processes that are out there are calling for robotic solutions, which maybe not. And then we can go on and use this actually to develop true use cases afterwards. So this was one of the major challenges for us. Without having the domain knowledge, it's difficult for us engineers to come up with good use cases and to use these use cases for starting good projects. So I've picked one example for what has been observed there. It's a nurse providing a meal, and just want quickly to run through. So it starts with the nurse walking to the canteen and checking out what's available this day. Then she walks back to the patient's room and asks what they would like. She walks back to the kitchen, gets some iced water, takes a tray, tells the kitchen staff what the patients wanted, provides them the room number, walks back to the patient's room, puts the tray on the bedside table. She puts herself on a chair, which she had to bring from another room beforehand. This is a bit implicit. Gets the pills from the patient's supply, puts on gloves, takes out pills and gives them to the patient. And it goes on. So she feeds the patients, motivates him to eat a bit more. estimates or documents what has been eaten, and there are some ambiguities. So is medister sausage, is that minced food or solid, smaller challenges on the way. She has to estimate how much actually has been eaten, and finally she brings the tray out to the corridor. All this took 30 minutes. This is one out of a couple of hundreds processes that we have been looking at. And I think it's very obvious we're not going to build a robot that can replace this nurse ever. But maybe one could have robotic solutions that could actually support this nurse. So she's actually running back and forth quite a lot. So there were reports that these nurses, they run 10, 15 kilometers a day. And that's time where they kind of, they cannot spend on the patients themselves. There's also quite a bit of communication going on, finding out what's available, what does the patient want, communicating that back again. This could also be something where ICT solutions could come in. So the HealthCAT project was actually also starting with talking to a nurse about the challenges out there. And this was a bit before the Lighthouse project started. And one of the challenges, so this nurse was from the geriatric ward, was that they had to measure the vitals of the patients at least once a day, sometimes even with a higher frequency. But they were lacking the resources to do so. So this resulted in nurses showing up early to work because they felt that they had to actually fulfill this task. Nurses being stressed because they worked too much and worked late hours to fulfill this requirement. And also, of course, also it led to this not being done, although it might actually be necessary. So we ended up with formulating this project where we included the specification of what exactly the robot has to do into the project, and then aiming at developing a prototype that actually is functioning and solves this task, and that we can test in both a lab and also at the end user site within the project. And ideally, 2 years after the project, this prototype should turn into a solution that could be commercialized. To do all this, we combined 3 university partners. We have SDU doing robotics, robot perception, robot control. We have University of Applied Science in Kiel working with user interfaces, so our robot obviously needs to interact with users in some way or another. We have the University of Lübeck knowing about medical technology and validation thereof. We have 2 companies involved. So Robotize is actually going to build the robot. Blue Ocean is looking at strategies how to commercialize this. So one task here is actually to pick a use case at the beginning that is commercializable at the end of the project. And then we have both a hospital, which are the end users when they have the domain knowledge. We also have the region, which turns out to be very valuable setting. So while the hospital has the expert knowledge on the problem itself, the region has more knowledge on how the whole hospital area actually develops over time. And the idea is that we don't pick a use case that might be obsolete in 5 years' time, but actually something that is still relevant then. And we have a Health Innovation Center of Southern Denmark that who are actually doing the needs analysis. And that's Louise. And she will now present on how they did and some clues on what came out of it.
Yes, thank you for the word. I just got stuck in the microphone here, so I'll try to see if I can get it. Can you please help me?
Yep.
Technique, right? And then Siri, she just slide me. Okay, is it working? Okay, good. Well, thank you for the word. First of all, please let me know how many of you are doctors for the healthcare sector? Yeah? Okay. How many of you are engineers? Oh, a lot more. Robot developers? Engineers, robot developers? Okay, it's always nice to know who you're talking to, so thank you. Okay, yes, I'm coming from the Health Innovation Center of Southern Denmark, and we are the innovation hub of the region of southern Denmark. Here is just the region of southern. Sorry. Well, where can robots make a difference for welfare? And in this case, healthcare. This was one of the questions we were going to try to answer by doing a needs analysis in the HealthCAT project. First of all, we needed to find out to identify and prioritize the needs which have the potential to be covered by a robotic solution. Second of all, we had to identify challenges and barriers for the development and the implementation of a robotic solution. And last, we need to identify and compare existing robotic solutions in the market. What we have done so far, we are actually in the middle, or a little bit over the middle in the process of the need analysis. We started early spring, where we started to plan the field research. We have done field research in both Germany and in Denmark, in hospitals and in nursing care homes. And there are many issues to look at when you're looking at the healthcare sector. Many potential areas for robotic solutions. And we couldn't just embrace them all and say, okay, we're going to find a solution that can solve all those problems. So we needed to delimit the area to a beginning. So we actually made an initial research to try to find out which are the main potential areas that are relevant in this project. After we had done that, we made a field research in Denmark and in Germany. We conducted field research at a hospital in Denmark and at a hospital and nursing homes in Germany. Right now, we just made the data analysis, and we were going to process, structure, and analyze data from the field research in Denmark and in Germany. And right now we are facing the benchmarking. We made a trend analysis, and we're going to benchmark of existing robotics technologies. Oh my God, see, she's not cooperating here. The initial research we made, we actually found that there were around 68 workflows that could work, that we could look at in the actual field research. And we couldn't deal with 68 workflows because it's a project at only 3 years, and the needs analysis should be done in around half a year. So we tried to shortlist those workflows and came up with around 10 themes, potential themes. And 7 out of those 10 potential themes we rated as the most relevant. We got help from both national organizations, experts, and staff at the hospitals and nursing homes to make this shortlist and to come up with those themes. The themes are those. I think it's actually quite difficult for you to read, right? Can you see in the back row? No? Okay. At the top icons, you see the 10 potential themes we had to begin with. And in the bottom, 7 out of those themes. The 7 themes we had to walk out into the field research with was, first of all, cleaning of wheelchairs, toilet chairs, beds, and nightstands. And we had the theme cleaning of patients' hands. We had a theme that covered cleaning of dentures. And a transport theme. The transport theme was actually very, very large. So we divided it in sub-themes. And the first theme under transport was transport of food. And the next sub-theme under transport was transport of small equipments like bandages, health measure devices, and so on. And the last theme under transport, sub-theme under transport, was transport of large equipments like beds, laundries, etc. The next theme was measurements of health parameters. Both the measurement of health parameters and the cleaning of patients' hands were actually the themes that we didn't, it was not one of the findings in the initial research. But it was added because we knew that it was time consuming. It was a task that is done several times a day and documented twice, not for the cleaning of hands, but for measurement of health parameters. So, yes, with those in mind, those themes in mind, we began the actual field research. As I just mentioned earlier, we did field research in hospital and nursing homes in Germany. And we did field research in hospital in Denmark. And the research period lasted from June, the beginning of June, until the end of September this year. And with a total user interactions around 88. We are 3 partners in the field research. And the Innovation Health Center, us, we designed the field research, and we have data collected, and we have done the analysis. And the German partner, the University of Lübeck, the researcher from there, they did the field research in the nursing homes and hospitals in Germany. And the Hospital of Southern Jutland, they carried out the field research in the hospital in Denmark. As I said, the Health Innovation Center was in charge of the data collection. And this is one of our tools. We call it the Wonderwall. And as you can see here at the Wonderwall, at the top we have the themes: cleaning, cleaning of dentures, transport here in the middle, measurements as the next one, and cleaning of materials at the last one. No, cleaning of patients' hands, sorry, at the last one. On the top is all the German data, and in the bottom here is the Danish data. Well, this was just, the picture was taken in the beginning of the process. So actually that was just a hint about where the data are. And as you can see, we got a lot of data on the transport, and we got a lot of data from the first theme, cleaning. Actually, I'm in a position where I haven't presented the result of the analysis for our project partners. So to roll out the result here, I think that will be a problem. We're going to present the results tomorrow at a workshop, but I will give you some insights about what we found. First of all, a quote here: it takes 5 minutes to pick up a patch. Well, it's just a classic example about that picking up equipment, small equipment, large equipments and so on, takes time. And well, that it takes time, that it's time consuming, it's just one issue. Another issue we found was that actually it's very difficult to locate where the equipment is, and the staff, they actually don't look at the place where it should be located because it's never where it should be, so they run around the department to find out where things are. Another insight is, well, there's a little intro to this one, this quote. First of all, when we carried out the field research, we were focusing on needs. not the solutions. It's very important. They're not to generate thinking about solution when you ask the respondents. Anyhow, the respondents, they came up with solutions. And at the nursing homes in Germany, they would like a robot for reading the paper or asking daily questions. So, is that a solution? Well, maybe we should highlight more that the carers actually don't have time for the interaction with the residents here. Another insight is that even there is a need, and there are a lot of needs, the infrastructure of buildings can be barriers. And actually an obstacle. An obstacle at the nursing homes are that there is always a lot of equipment in the hallway. I think the same count for the hospitals. So when you're thinking about a robot there, a robot that should get around in a hallway where there are like 40 wheelchairs placed. Luckily, it's not me that are going to develop the robot, but other people, other partners. Well, the next step, we know something about the field now. We have found a lot of findings, a lot of insights that confirms that the themes were relevant, and actually that some themes are more relevant than others. So the next step is that we're going to convert the findings into some use cases. And we have actually developed some early use cases. And the most important thing here is to get it qualified by the staff. And we have actually had some from my team that went to the hospital last week to get those early use cases qualified. Why are we doing the needs analysis? Well, I think the next slide actually talks for itself. Some of you have probably seen it before. The screaming robot. I made a robot that screams. Why? It's very important that a robotic solution meets real needs. So what we've done in the needs analysis is focusing on needs. The needs are very important to develop the right solution, to find out which one is the right solution. And it's very important to do the needs analysis to find out if there could be issues regarding implementations. And last but not least, it's very important to make the benchmarking here as a part of the needs analysis to find out if there is a commercial potential. When you looked at some of the themes we had, maybe some of you thought, okay, my God, how are they going to make solutions or think solution user scenarios for those themes? Let's just take the cleaning of dentures. The cleaning of dentures, the workflow is actually to get a denture out of the patient or the resident's mouth and to get it cleaned and get it in again. Does this call for a robotic solution? Well, it's a very relevant question to ask. We maybe have a lot of needs, but you always need to match it with the right solution. And often a robotic solution is not the answer. So, any questions? If you don't have any questions now, you feel free to contact me or my team. They're sitting down there afterwards and have a chat. Okay, thank you.